Hello everyone. Thank you for gathering today. I am Dr. Robin Gupta, consultant neurosurgeon at GM Hospitals. So today 8th of June is a very important day. We celebrate it as World Brain Tumor Day. And today on this occasion we are going to discuss on this important topic, brain tumors. So basically in this FB live session we'll be discussing about what are the symptoms of brain tumor, how to diagnose the brain tumor, and what are the treatment options, and how to live with this disease. So what are the symptoms of brain tumors? Now the symptoms of brain tumors basically depends upon what is the size of the tumor, where exactly it is situated in the brain. Those things matters for the symptoms to appear. The most commonly the patient will present is with headache. If a patient is having recurrent frequent headaches, one side of head he is complaining of headache, and the headache is associated with any blurring of vision or any vomiting, any nausea sensation, which is persistent for a very long time, then you should ideally consult a physician or a doctor or a neurophysician or a neurosurgeon nearby hospital. So basically other symptoms which can appear is weakness of one side of the body, or there can be a basically difficulty in walking, imbalance, vision difficulty, you are not able to see clearly on one side of the eyes, or you are feeling that basically suddenly you are losing a vision in one part of the eye, or you are not able to hear properly in one of the ear. These are the common presentations with which a patient can appear present with brain tumors. So whenever you encounter your loved ones or you yourself you encounter any of these symptoms, like you're having frequently headaches, then ideally you should consult a neurologist or a neurosurgeon and then diagnose with your brain tumor, or what are the other uh, things which can lead to all these things will also be diagnosed once you consult a neurologist. So what is brain tumor? Brain tumor is nothing but abnormal growth of cells in the brain itself, or it's covering, it's a layer which is covering the brain, which is called as meninges. So anything abnormal growth of the cells in this can lead to brain tumors. So it can primarily arise from the brain, it is called as primary brain tumor, or it can be a metastatic tumor, that is a tumor elsewhere in the body which can spread to the brain. So that is called as metastatic tumor. Now, what are the types of brain tumors? There are many different types of brain tumors, but to understand in general, there is gliomas, which is basically the tumor arising from the brain cells itself, and which is one of the most commonest type of brain tumors, and which is usually graded from grade 1 to grade 4. If we say it is grade 4, it is called as glioblastoma multiforme, which is very highly malignant and which will reoccur in the brain and in which the mortality is very high. But definitely in grade 1, grade 2 and grade 3, there are treatment options available and the outcomes are better than grade 4 tumor. Then the other type is meningiomas, which basically arising from its layer which is covering the brain. It is called as meninges. So basically it arises from that dura and it is called as meningiomas. And it can arise any part of the brain depending upon the location of the tumor, and the symptoms also will vary because based on the tumor where it is arising from. So same way there is also pituitary tumors which are also very common. It will present with its hormonal features, like because it may also lead to compression of the eye nerves and lead to vision difficulties and sometimes hormonal issues. So that is the early ways which would be with which we can diagnose as pituitary tumors. Then there are some schwannomas which can arise in the brain, which is also called as acoustic schwannomas. They will have a different presentation. They will have presentation mainly as hearing loss. The patient will not be able to hear properly in one of the ear, and along with that they will have abnormal pain in the face, or they may have difficulty in the walking, or they may have basically facial deviation. So these are the presentations which can present with different type of tumors. According to WHO, brain tumor comprises 2% of all the tumors in adults and 1.9% of all the tumors in children. Brain tumors not only affects the individual patients, it also affects the families, and in fact the whole community is affected when one patient is affected by the brain tumor. So they carry a very important weightage, and awareness about brain tumor is very important. What are the treatment options available for brain tumor? Now, first is most important is to diagnose the brain tumor. How to establish a diagnosis? The most important thing is once is clinical diagnosis. The neurologist or neurosurgeon will assess clinically, do a complete neurological examination, and then based on that, that patient has to undergo a imaging. So mostly MRI or a CT brain is done. Now MRI with contrast or plain depends upon the neurologist or neurosurgeon's clinical assessment. Mostly when we are suspecting any brain tumor, we'll be going ahead with the MRI brain with contrast. So once the MRI is done, it will clear our diagnosis where exactly is the tumor, what is the size of the tumor, and where exactly it is situated in the brain, whether we can surgically try to remove it or what will be the next line of treatment. Most of the things will depend upon the MRI findings. So once a patient is diagnosed with a brain tumor, there are various treatment modalities which are available for the treatment of brain tumors. Surgery plays a major role. Whichever tumors we can remove surgically, they can have a complete cure of the tumor. Now, even in the brain tumors, there are benign tumors which once removed completely, they'll not come back. Then there are malignant brain tumors in which even if we remove the tumor completely, it also requires adjuvant treatment like in the form of chemotherapy or radiotherapy or a newer treatment modalities like targeted therapy or immunotherapy. So there are various ways with which the brain tumors can be treated. Now again, there are brain tumors which are deeply situated where we at least have to get a diagnosis for them. Stereotactic guided or navigation guided biopsy also can be done or a robotic guided. So basically these are the ways with which we can at least get a tumor biopsy and send for the analysis, and we'll know what type of brain tumor, what grade of the brain tumor is, and next adjuvant treatment will depend upon that. Tumors which are grade 4 like glioblastoma multiforme, which is GBM, which is commonly known as GBM, and which is very highly aggressive. In that there are different modalities like radiotherapy, in which the radiation will be given to the whole brain and also to the tumor bed. Even after removing the complete tumor, you have to go ahead with the radiotherapy. Now even in radiotherapy there are different modalities, there are different ways of giving radiotherapy, and once the radiotherapy is done, we also continue with chemotherapy. Chemotherapy in both ways by IV, that is intravenous injection, or even in a tablet form. Mostly in gliomas or glioblastoma multiforme, GBM, which we are talking, will continue with tablets. And apart from this, there are also newer modalities which I discussed earlier also, immunotherapy and targeted therapy, which targets the tumor cells. So these are newer ways of treating higher grade of gliomas. Living with this brain tumor. So once you are diagnosed with brain tumor or your loved ones are diagnosed with a brain tumor, there are basically helps available. There are groups, social media groups. Also, there are basically rehabilitation centers and helps are available. Once a patient is diagnosed, even after the treatment, there are helps available, groups available. So you are not only alone, you have people who are having the same conditions. And I would say it's not a disease, it's just a thing which is diagnosed and it is treated. You can just go and discuss with people. There are helps available, hospital is there. Even at our hospital we have rehab centers, places, and help is available for everyone who is diagnosed with this condition. To conclude, basically how to avoid these things. One is you need to have a healthy lifestyle, not only for the brain tumor, even for any other any other cancer in the body also. Most important is you need to have a healthy lifestyle. You should sleep in time, get up in time, spend some time for yourself. You need to be physically fit. You need to basically at least have 45 minutes to 1 hour for yourself for physical activity. Invest time in that. See, that is the most important thing for yourself, which will basically help you in long term. If you go for running, walking, or even gym, even if you are going to gym doesn't mean that you have to lift very heavy weight. It should be basically any physical exercise in any form, at least for 45 minutes. Do that. Avoid taking too much of sugars. If you are diabetic, control your sugar levels. If you are hypertensive, control your BP. If you follow all these things, follow no smoking, no alcohol, no drugs, all these things if you follow, definitely not only brain tumors, other cancers also, you will be basically prevented from all these things. And once you or your family or any loved ones is having these problems, like is having recurrent headaches or vomiting or having any weakness in any part of the body, please consult a nearby neurologist or a neurosurgeon or a hospital which is there nearby. Thank you everyone. Thank you for being part of this FB Live, and you can reach out to us and please put your questions and whatever your queries in this comment section, and you can follow us on GM Hospitals in FB. Thank you.